Hello, my name is Erica and I'll be your nurse for today's procedure. I'm going to go through the steps of the surgery for today one more time before you change into your gown. And if you have any questions, please ask at any moment. I'm here to make sure you're as informed as much as possible before we start for today. Today, Dr. Nguyen will be performing a Mohs procedure on your basal cell carcinoma on your zygomatic bone, which is on the left side here on the cheek, 4 inches from your nasal area and all the way down to the end of your cheek. The basal cell carcinoma is the sore area around the facial area that you have, and usually this is caused from very sun-exposed areas to the body. This comes from ultraviolet radiation, which causes damage to the basal cells in the epidermis layer of your skin, which is the upper area of your skin. Just to give some background information. The Mohs procedure is going to involve 3 steps today, which is removing the cancerous cell, having pathology check out the skin to see if the tissue is the one that we're looking for, and then lastly closing up the cut. First, we're going to place a local anesthesia in the cheek area, and you'll be awake for most of the procedure, but when Dr. Nguyen, he'll go ahead and walk you through each of the steps as you go. Dr. Nguyen is going to remove as much of the cancer as possible with the scalpel in sections starting at the top epidermis layer of the skin, and then sending the lab the tissue to make sure we're removing most of the cancerous cells. This is going to happen until Dr. Nguyen is sure that he has taken out most of that tissue. The main goal here is to get rid of most of that cancerous skin in the area. We're also going to try our best to make the smallest scar possible, considering there will likely be some scarring after we're done here today. But we will observe the scarring on your upcoming follow-up day after the procedure. This procedure is going to take about 5 hours, and once Dr. Nguyen is done, I'll come back to help you be as comfortable as possible while you recover. After we're done, I will send you off with some instructions on how to care for the wound after the healing process. Dr. Nguyen and I will schedule a follow-up soon to take out the stitches that are in that area after you're done here today, and also look at the area to see if the healing process is going as it should. Just to make sure none of that cancerous area returns and your scar is closing like it should. Again, I'm here to answer any questions that you have. Dr. Nguyen and the rest of the team are going to make sure we're doing the best we can to make sure you're comfortable as possible during the whole procedure.